You're listening to The Artist Athlete, episode 108. This podcast is dedicated to CIRCUS. It's a place for professionals in the industry to share their stories, viewpoints, and information, and a place for outsiders to get a sneak peek into this world. Hey, friends, fans, and foes. I'm Shannon McKenna. I'm the host of the Artist Athlete podcast and the founder of theartistathlete.com. Okay, so my guest today and I also have this podcast in visual form on patreon.com/theartistathlete. If you're a Patreon, you can watch us talk to each other. We're not just amorphous voices floating in the ether anymore. We have faces, we have hair, and my guest, who is a physio, shows one of the exercises that she likes to use to help micro instabilities in the shoulder. What's a micro instability? Listen to the podcast and you'll find out. And to see the exercise and to see so much more behind the scenes stuff, get discounts, and just to overall support this crazy project called the Artist Athlete Podcast, go to patreon.com/theartistathlete. I know you've been meaning to for a while. You love listening to the podcast every week. And just so you know, every dollar goes into making this podcast better. We are thrilled to be producing video now, and so much more is coming. Patreon.com/theartistathlete. My guest today is Simone Muscat, aka the Pole Physio. Simone is an APA-titled sports and exercise and musculoskeletal physiotherapist located in Melbourne, Australia. Driven by a passion to help others and a fascination with biomechanics and injuries, she has created the Pole Physio to help the broader pole and aerial community. Through evidence-based practice and knowledge, Simone hopes to empower aerial artists by treating and preventing injuries and tailoring strengthening to help dancers and artists achieve their nemesis trick. Simone can be followed on Instagram at thepole.physio and is available online for injury consultations for patients all over the world. Simone can be followed on Instagram at thepole.physio and is available online for injury consultations for patients all over the world, unless you're in the USA. And her website is www.simonemuscat.physio. Wow, there's a .physio? That's incredible. If after listening to this episode you cannot get enough and you simply must listen to more circus-related physios, I've got them for you. Cirque Physio did a 2-part episode all the way back on episode 7 of the podcast. I had I didn't even have a logo back then. And Dr. Jen Crane is on that episode. And Dr. Emily Sherb, who is the circus doc, is on episode 20 with possibly one of my favorite titles, You Can Fix Stupid. So go check out those episodes. But first, here is my interview with the Pole Physio, aka Dr. Simone Muscat. Simone Muscat, thank you for joining the Artist Athlete podcast. Thanks for coming on.
Thank you so much for having me.
Can you tell the people at home who you are and what you do?
I'm Simone. I'm a physiotherapist based in Australia. I am the Pole Physio, and I've got a little mini company going on here where we're trying to provide free blogs to the world of aerialists, so particularly pole dancers, to provide best practice medicine and healthcare out there in the community, so making it accessible for everyone. And I also treat pole dancers online as well as in clinics in Melbourne, Australia.
I've had a couple of physios from the US on my show. But never in Australia. Well, I've had an Australian physio, but she's not a practicing physio. She's an aerialist. So I'm curious as to what the process of becoming a physical therapist in Australia is like.
It's really challenging. So if we go all the way back to when I finished high school. So when I went through you had to get an enter score to get into uni straight into a bachelor degree, and it was pretty high. So it was almost as high as medicine, effectively. So that was the only way to get into physio back then. Now there's a couple of different pathways available. So it was a 4-year bachelor degree that I went through. Now you can go and do a 3-year general science degree. So health science, medicine degree of some sort, biomedical degree. And then you go and do another 3-year degree in a doctor of physio or a master of physio along those lines. But effectively that just gets you an entry-level graduate position as a physiotherapist. And then you go and do further study once you are a physio. So you go and do your titling. So it's a little bit different in Australia compared to, say, America, Canada. I know that there's a few different pathways there, but the way we do it is that you undergo titling process. So you work as a physio for maybe 4 or 5 years, and then you go for further study and actually get your title as a sports and exercise or a musculoskeletal physiotherapist. And then from there, you can go to do your specialization or potentially even a PhD in that whole process. So physios can be studying for anywhere between 4 or 5 years or 6 years all the way through to 14, 15 years to, their full complete career. So it's pretty incredible. So I've done about 9 years of physio study so far. So I have a double master's behind me as well as my bachelor degree. I'm a qualified strength and conditioning coach, and I've gone and done business management degrees and a whole bunch of other different things. So I feel like I'm just constantly studying. So it's pretty crazy to be a physio in Australia. Yeah.
That's wild. Okay, so you said so titles. You get different titles as a physio? And what's your title?
So it's a long one. I'm an APA titled sports and exercise physiotherapist and an APA titled musculoskeletal physiotherapist and strength and conditioning coach.
Work.
Yeah.
Love that for you. That's a lot of letters behind your name.
It's a lot. Yeah.
What made you kind of go that route?
Yeah. I was a weird child. I think most of us are in our own eclectic way, but I was the weird one.
I think all children are weird, actually, but yeah. Anyway.
I kind of knew from the age of 8 that I wanted to be a physiotherapist. My sister was an elite level swimmer. Yeah, exactly right. So she was an elite level swimmer. She hurt her knees one day. We went and saw the physio, and I just left that appointment, with mum, and I turned to her and I said, I want to be a physio. And that was it. And there's footage somewhere of me in grade 6, when you finish school and they're like, tell us what you want to be when you grow up. And I was there, I'm like, I want to be a physio. There's footage somewhere out there of me saying that. And I can specifically remember that moment. So it just was very set from a young age. From 12 years old, I knew what subjects I had to do to get into physio. I knew my enter score I needed to achieve. I knew the pathway. I just had everything planned out. So I was a really super nerdy, weird child, but I think in an adorable way. So I look back and I go, that's actually really cute. If someone came and told me that now and they're 12 years old, I'd be like, yeah, work. That's awesome. That's so good. So that was sort of the pathway that I wanted to always go in. And I had a passion for biomechanics just from, again, a very young age. I loved watching Australian rules football. So we call it AFL here. And I was really fascinated by the injuries.
It's crazy. Australian football is nuts. I remember being in Australia and watching it, and I was like, what is going on? So, yeah, okay.
It's amazing. If you haven't watched a game, watch it. It's incredible to anyone who's listening to this. But yeah, my dad used to take me to the games, and I wasn't really that interested in watching the actual game. I was always really interested in what was happening on the sidelines. So I'd always be watching the physio. I would always be watching what the players were doing when they were coming off the ground and how their treatment was. And that was from a super young age. So I just always preferred being on the sidelines. So that sort of sparked my interest in sports and exercise physio. And then when I went to uni, it pretty much confirmed it. We have to study so much, in a crazy amount of detail. It's insane in the sense of I would be qualified to work in ICU as soon as I graduated. And then I could go from ICU to geriatrics to pediatrics to cardiorespiratory. So just the knowledge that you need in Australia to be a entry graduate physiotherapist is incredible. But I just didn't enjoy it. I didn't enjoy any of it. except for the sports and the musculoskeletal parts of the degree. So I really enjoy that. So I knew that that's the pathway I wanted to go down, and it just sort of spurred me on from there. And I just sort of hit the ground running as soon as I graduated, entered private practice, and joined with a few sports teams, and travelled Australia and the world with hockey and football, and then ended up in pole physio. So it's been a bit of a journey so far. Yeah.
Biomechanics is a word that gets thrown around a lot, and you've used it and obviously love it. So can you define what exactly is biomechanics?
Oh, look, I don't have the proper technical terminology on me, but it's...
Yeah, no, great.
You're like, just layman's terms, please. It's the way we move our body. So everyone has their own, I guess, fingerprint in the way that we use our body and move ourselves. And biomechanics are the way our knee joint moves when we go to do a particular movement. So whether our knee wants to rotate inwards versus outwards, that's what I'd term biomechanics. So we know, and this sort of comes down to the injury prevention side of things, which I love, and we can talk about maybe even later. We know that if someone rotates their knee inwards, biomechanically they're loading up their knee joint, and that predisposes them to injury. So that's what gets me excited, is going, I know why that person's injured themselves, because of this, and this is where we can potentially intervene and fix that issue. Yeah.
Very cool. That's awesome. Thank you for that.
That's all right.
So you knew you wanted to be a physio. I can't imagine as a little girl, you were like, I want to be a physio and I want to fix pole dancers, mama. Like I...
No, that was not quite the words.
But maybe I would be so here for that child. That's adorable to me.
Yeah.
So when did you start getting, or how did you get into the pole world?
Yeah, it was kind of by accident, but not at the same time. It was, I started pole about maybe 5 or 6 years ago. I just felt like I was in a bit of a rut. I was like, personally, a couple of years out of uni, maybe a couple more than that, but I just felt like I was in a bit of a moment in my life, and everyone's probably experienced it, where you just feel flat. And I had this passion for dancing, but I had a passion for strength and conditioning and fitness. And I remember seeing this YouTube video, and this girl was amazing. She was just absolutely killing it on this pole, and I just went, I want to do that. Like, that would just be epic. And I mentioned it in passing to a friend, and then next minute for my birthday, they bought me a private session with Miss Philly, who is one of the world's most insanely amazing pole dancers. And I didn't know this at the time. I remember walking in going, just don't look up who this person is beforehand, because you'll shit yourself and then you'll just want to walk right back. And I'm so glad I didn't look her up, because as soon as I looked her up after the session, and I almost fainted, and I was like, oh my God, she just took me for a one-on-one beginner session, and she's one of the most incredible pole dancers out there. So from that moment, from that one session with Philly, I was pretty much hooked. And I didn't realize this at the time, but I just happened to walk into pretty much one of the best pole dance studios in all of Australia, with some of the most incredible pole instructors and just people around. And I just became addicted very quickly. And sorry, this is becoming a very long story, but effectively I tried to separate my personal life and pole dance. I tried to go, this is like my space, and I don't want to have to think about physio here. But then I just kept on seeing everyone get injured, and it made me pretty sad. So at the start of every class, the instructor always goes, okay, any injuries to tell me about. And there would be a class of 20 girls, and like 17 of them would be like, yep, this, like ongoing niggles. And it was just one of those things that they'd go, yeah, have you seen anyone? And they'd go, no, I'm just managing it. Or, yeah, my physio just doesn't know what to do. And it was just getting to me, and I went, right, enough's enough. So it was probably a couple of years into my pole dance journey. I went, right, I'm not going to separate them anymore. It's time to sort of collide passions. And I think it just worked out really nice in terms of my own work, that I was starting to wrap up a few things with AFL, and I went, I've got more time and energy to invest in pole dance. And I was studying my master's at the time, so I was finding it super fascinating with all the biomechanics. And it just sort of exploded from there, and I started treating pole dancers. And I think I treat pretty much most of the girls at the studio now, whether they liked it or not. They will come to see me at some point. So, yeah.
How is treating an Australian footballer different than treating a pole dancer?
That's such a good question. First of all, the flexibility. So that's probably who I think. So I was super lucky with AFL. So I treated both the males and the females. So I was with for anyone who's listening that's Australian, I was with Carlton Football Club with the AFL women. So I did get to experience that side of things where there was potentially a bit more flexibility in the women than the males. So I was quite lucky. But a lot of my clinic staff were so used to my Carlton girls or just general footballers that I've treated coming into their sessions and appointments. They would be seeing my colleagues as well. And then they sort of started to notice a very distinct shift from treating the footballers to suddenly a lot more pole dancers coming in. And I remember one day one of the physios went, I just tried to test her hamstring length and it just kept on going and going and going. And I thought I broke her. And I went, no, you didn't break her. You probably could have taken her further. So I think that's probably like one of the funniest things. I just remember the physio panicking and I was just like, no, this is normal. So the mobility side of things is probably the biggest thing. Definitely, I think AFL players are stoic and they're very strong and they're definitely very passionate and they want to do their sport. But pole dancers even more, like aerialists even more so. Like they just really push through so much because of just the love and the passion. And the crazy thing about it is they don't get paid a lot of them don't get paid to do their job to go and perform, whereas say AFL players get paid millions and millions of dollars. Well, the best ones do get paid millions of dollars to, do their job. And I would just say the grit and the determination behind pole dancers is almost the same level. It's just the access to the medical side of things is obviously very different.
Yeah, that's a good point. Yeah, I always thought that was so funny. I remember one time going into a physio in the US and I had some shoulder pain or something and they were just like, doing a basic kind of scan of my body. And they asked me if I could touch my toes. And I was like, oh, yeah. And I like just bend it over and I can put my elbows on the ground, like I'm very flexible. And they were like, whoa, that's crazy. Are you guys not? And I don't know why. I guess because I see it all the time. So it's like totally normal to me that people would have that kind of flexibility.
Yeah.
Is that not something that you see in physio school at all?
No.
Like you're not trained for any of that?
I think that they briefly mentioned to you the outliers, but effectively aerialists are outliers. The amount of mobility that they have is just not what would be considered norm. And that's okay. Like that's what's so special about, aerialists in general, is that they have this amazing amount of mobility that most people can't access, or they're working towards that amazing amount of mobility if they don't have it to start with. And a lot of aerialists and the best ones out there are hypermobile. And so they've been born with this to start. So yes, you do see the outliers in, normal private practice, but unless you deal in this, like with this area every day, you just wouldn't expect it. Like you wouldn't expect someone to be able to pop their elbows on the ground. So it's quite a special thing to be able to have that much flexibility. It's what makes us so unique.
And so then, talking about kind of what you were saying before about biomechanics and how, you can kind of look at a person and assess risk of injury based on like the way their knee is turning or something like that. I would imagine then if you have someone with extreme mobility or something, like how do you assess them differently?
That's such a good question. So a few different factors. So if you're it depends what you're trying to assess for, I guess. If you're assessing because they're injured, then you're just taking that into consideration that they may be hypermobile. And so you're looking for a few different factors. There's a score out there called the Baden score, which I don't know if you're aware of it, but it very briefly assesses signs of hypermobility. So things like, can you pull your thumb back towards your forearm, pinky back past 90 degrees, straight elbows, hypermobile knees, all those sort of things. And can you put your palms flat on the floor? So that's a sign of hypermobility if you can pop your palms flat on the floor. Now, for an aerialist, most of us can do that. That's not necessarily hypermobility. So there's some things we take into consideration, and for the normal person and for an aerialist, I'm like, that's maybe normal for you. So we're just looking for those sort of factors as a general screen. But it depends on what you're trying to look for. So if someone comes to me injured, I'm just trying to figure out what may have contributed to their actual injury, what's potentially driven the pain, versus if someone comes to see me to prevent an injury, or if I'm trying to see whether someone's ready to perform a trick. So I think that depending on what I'm looking for, I will assess it differently. So for example, is it flamingo grip in circus? Is that the twisted grip name?
Yeah.
Yeah.
That's what I call it. Yeah.
Yeah. So if it's flamingo grip, like you wouldn't be able to do that in pole or silks if you don't have full 180 degrees of flexion and full internal rotation. So like it's basic. So if someone comes in to see me at the clinic and they've only got 160 degrees of movement, I'm not going to let them do that move until they've got the full range. The other thing is they need to be strong enough to stabilize that internal rotation position. So they need to be able to stabilize that external shoulder strength. So until they can do that, I'm like, no, because you're now setting yourself up for injury. So that's how I'd go down that injury prevention side of things, and also a screening, side of things as well for pole dancers or aerialists in general. So figuring out the demands of the actual move itself versus if someone's come in and they've hurt themselves doing that trick, I'm like, okay, why have you potentially hurt yourself? Is it because you don't have full range? Is it because you can't actually stabilize? So it just depends on which side of the coin you're looking at.
Okay, but it really does sound like it requires a physio who knows the terrain.
Oh yeah, 100%. Like the pole world and the aerial world is just so different. You really need to know your tricks. You really need to know the demands that are placed on the body. Like, are you going from a loaded internal to external rotation position as you're traveling from, a pixie to a Superman position? So like that sort of movement, it's very specific, and you could dislocate your shoulder or you could sublux it. But, what part of it was it that you were subluxing your shoulder? So these are all the factors that you have to take into consideration. And a normal physio just has absolutely no bloody idea, like just nothing. It's fascinating when you start talking to a normal physio about this, and they're just like, it's a completely different world. Yeah.
Yeah. Hey. So you mentioned off air that you were booked a month in advance, and I know the other, Cirque Physio, who else? Emily Sherb, Circus Doc. They're far and few, but you guys are far and few between.
I know.
You're an elusive bunch.
They're amazing.
So people, yeah, they are. Yeah. People who are not able to access you guys and have to go to a normal physio. Like, is there any advice you could give to people who have like a standard healthcare provider or standard, physical therapist to kind of help guide them, like to tell them how to treat them, basically?
Yeah. So that's a really good thing to know. So the best sort of advice I'd give is, first of all, show the therapist what you're actually trying to do. Because even a basic physiotherapist who has no Cirque aerial understanding, they could at least break down the biomechanics of the movement step by step in their own head. So they might look at an Aisha and go, okay, for the bottom arm, you need to be able to do this and this, and like they can at least break it down to basics. They might not understand all of it, but they can get the minimal component. And ideally show them a video of someone who is doing it really well. So it might not just be you doing it. Show what you want to achieve and then how you've done it. And then they can potentially go, all right, slow motion, look through it. That's probably number one. Number two, make sure you're seeing a good physio. It's like you said, it's few and far between. But like in Australia, we do have titled physios for a reason, because they are senior physios. They've gone and undergone further study. But not every physio that's not titled isn't a good physio. So you could go and see a physio that's maybe got 10 years out experience. They've been doing it for quite some time, and they maybe have a special interest in shoulder injuries, but they don't necessarily haven't gone to uni to do further study. So seeing a physio that's really got some broad experience is going to be helpful, as opposed to seeing, say, a junior physio for an injury that maybe is a bit special with the world of pole dance or aerial. Yeah. The top two tips anyway.
Those are really good. Yeah, one of the things I'm always looking for is like someone who asks good questions. Yeah, instead of telling me just to not do something, when they're asking questions, that's when I'm like, you're a good physio.
Yes. If someone tells you to not do something, they better have a good reason why. Like that's probably my one thing. Like if a surgeon says don't run again, I'm just like, why? Like, why are you saying this? What is your reason for why this person cannot run again? And it happens all the time where I see patients come in and they've gone, surgeon said, I'm never allowed to run again. I'm like, well, like we can get you running again and that's so fine. And so it's just about questioning sort of the status quo and going, well, why is this acceptable? Like, if I ever say to a patient, I don't want you doing this or this, it's because I want you to deload from this particular movement for 2 weeks, and then the aim is to reintegrate back to that movement. I never say to my patients that you can never ever do that again. That is like the words that I'll never ever say to a patient. And I, touch wood, have never had to say it for God knows what reason, and I hope to never say it, because I believe every patient can do anything that they want to. They just have to build up the capacity to doing that. And I think that's a sign of a good healthcare professional, not just physio, is if someone turns around and says, just don't do that, that's a massive flag in my eyes. Whereas if someone goes, okay, let's not do it for a short period of time, let's build back into that, that's okay. That I'm happy with.
That's awesome.
Yeah.
I love that. What are the most common injuries you see in the pole world?
Shoulders and
yeah. And I'm just thinking initially when like those 17 people of the 20 in your class were like, I have this thing. Were they all pointing to the same place in your shoulder? What
That, like, funny enough, they were all different. There's no, and I don't know enough about Cirque in terms of like the whole about research out there, but I know that there's a exercise physiologist in Western Australia who did an epidemiology study as a part of her thesis, Dr. Joanna Nicholas. So she basically had 103 participants in her study, and she categorized each and every injury, and out of those injuries, 21 of them were shoulders, and I believe it was 12 were hamstrings. The next was neck. So it sort of went in this order: neck, lower back, wrist, and then there were like foot, ankle, and all those sort of things. And there were sort of only 4 or 5 patients that had foot and ankle injuries. So you definitely see a broad spectrum, but the big one was shoulders, followed by hamstrings. So when people are in the class pointing to the shoulder, it's not the same area. So some of them will be pointing anterior, some of them will be pointing posterior. And I think that pole dancers and aerialists, again, we place quite a lot of a load on our shoulders, particularly in inverted positions. So a lot of pole dancers have micro instability of their shoulders and they don't realize it, which is kind of a terrifying thought for not many people to actually understand that. And then a lot of pole dancers are just impinging their shoulders. So one of the biggest things I've been trying to push out there is ways to reduce shoulder impingement. That is a really simple biomechanical fix that can be just prevented so easily. The micro instability is a little bit harder. So I've got some stuff on my Insta page that I posted recently about how to actually correctly engage the shoulder, how to elevate and break the bar. And that's, a term that's been coined by Cirque Physio, who's just done amazing work in that area for years. And same with Emma Sherb. They've been fantastic promoting this amongst the circus community. It just needs to be promoted more amongst the pole community. So yeah, shoulders are definitely the big one. And then hamstrings are hamstring tears and proximal hamstring tendinopathies, because we want to be flexible people, and some of us aren't flexible. Some of us weren't born with the flexi stick, hit it from birth. So yeah, a lot of people just push their passive splits too far. So I'm just doing actually a series at the moment on active and passive flexibility and trying to educate the masses about how important active strengthening is for full range of motion. Yeah.
Yeah. Yeah, for my audience, a lot of them are also Cirque Physio fans. And I think the break the bar, that overhead external rotation, the, active versus passive gap, these kinds of things are pretty familiar to me. However, micro instability is not something I hear a lot about. Can you talk a little bit about finding micro instabilities within the shoulder?
Yes, absolutely. Yes, I can definitely talk about that. There's a really good shoulder physio in Melbourne, Dr. Lynn Watson. So if anyone who's a little bit of a nerd out there that's listening, check out some of her research. She's done a lot of work on anterior, posterior, and micro instability, as well as multi-directional instability of the shoulder. Basically, we're talking about the glenohumeral joint, so the shoulder, translating. So whether it's potentially sliding forward under load or sliding backwards under the load, or potentially multi-directional. And so it's kind of like it's subluxing, so moving a little bit out of the joint, but not enough that it's actually causing acute pain at the time. Particularly when you do this over and over again when you're in an inverted trick, it's just sort of like gradually wearing away the passive structures of the joint. So that's your cartilage and your capsule. So those structures and your ligaments, they keep the joint nice and strong. The next layer is effectively your muscles. So if your muscles are working to engage, your shoulder won't move around in the joint. We can't really do anything about our passive structures. We are what we're born with. Unless, you go in for surgery and they do something weird and wonderful to anchor it, that's what we're born with. And so some people are lucky. They've got really nice, tight passive structures. Other people are hypermobile, and so they've got really loose connective tissue in the joint. So they rely really, really heavily on all the muscles around the shoulder to stabilize it. And so a lot of pole dancers happen to be hypermobile. It's just sort of is a bit of a natural crossover. It's, again, I said some of the best contortionists, aerialists, gymnasts in the world are actually hypermobile. So they rely on all those muscles to do the work to stabilize the joint. And so if you're not, you're potentially doing a trick upside down and you're potentially subluxing your joint without you realizing. So that can lead to bigger issues over time. So I see a lot of aerialists who have a combination of both impingement and subluxation in their shoulder, and they've potentially treated the impingement really nicely, but they haven't actually treated the micro instability side of things. Yeah.
And how do you recommend they treat a micro instability? Are there like things, I know like there are like these things you can hold and kind of like go back and forth that kind of look like
those
ski
ball
poles
thingies.
a little bit, you know what I'm talking about?
Oh,
yeah.
They're so weird. I don't know. Have you played with one of those?
They're so weird, and I never feel like I'm doing it right.
I never feel like I'm doing it right either. So I don't usually do that. They're really good at proprioception. But yeah, I'm not a big fan of them personally. I use a resistance band. So here's one I prepared earlier. So I would just do all your external rotation strengthening exercises with a resistance band around the shoulder. So at the moment, that's pulling me forward anterior. I'm going to use all my posterior stabilizers to pull into the band, and then I would just be doing whatever external rotation strengthening it is. So you could still do your break the bar exercises, but you'd also have an additional component of glenohumeral translation to stabilize the joint posteriorly. So just that little addition there can actually help those patients the next step. Yeah. So not everyone needs it, but if you do need it, it's so
brilliant.
Cool. Yeah, it's a bit of a life changer, and you can put it into everything. You can put it into your bent over rows, your flies, your lateral raises, all of those things to try and actually train that posterior stability.
That's so cool. And anybody who's watching this on the Patreon, Simone just gave a lovely example of what she's talking about. If you're only listening to this, you've missed out. So join the Patreon and watch the video.
Yeah, absolutely.
Thank you for that bonus content. That was awesome.
Welcome.
Very cool. I want to ask a bit about injury prevention.
Yes.
I think it's such an interesting term. And this idea of prevention, I mean, in pandemic worlds, like we've seen Australia's done an amazing job of prevention, but we've seen the dangers when it doesn't happen. First of all, how do you how can you know if something is going to prevent injury?
You don't.
In terms of
you don't.
Great.
You definitely don't. So the true nerds amongst us will know that injury prevention is not the right terminology. Like I will throw out injury prevention all the time because that's what people relate to. Like people want to know that you can prevent injuries, but I'll always explain that I can't prevent an injury. I can only reduce your risk of having an injury. So it's that whole risk reduction concept. And you won't know is the best thing because you hopefully won't get injured. So that's sort of the paradox. What we know is, and again, it comes down to those epidemiology studies. So like the one I chatted about earlier from Joanna Nicholas. So if you look at all of the information she provides, it actually breaks it down and says, there was 3 injuries that were caused by loaded internal rotation. There were 3 injuries that were caused by this mechanism. And she actually goes into that breakdown. And we just need more research like that. So until we have that research, we won't really know what the high-risk factors are for these injuries. We're just guessing, a really good hypothesis, so to speak. And we can take information from other sports and apply it to pole. So we can use the sport of rock climbing, we can use gymnastics and dance, and we can take little factors from that research and their epidemiology studies and go, okay, well, in this population, for gymnasts, we know if they're collapsing through their shoulder, they're more likely to have impingement. So we can apply that to pole. and then we can follow through that. Ideally, you need to screen the population and go, okay, this patient, they're really weak in their external rotators. They're more likely to have a loaded internal rotation injury. Let's implement some motor control changes. And it just is that basic. Like in theory, it can be really complex, but it just comes down to basic principles in the end. And there are always going to be modifiable factors for a patient and non-modifiable factors. Like I said before, patients are sometimes hypermobile. We can't change that. Like there's nothing I can do to make a patient less mobile, and I don't want to make a patient less mobile. That's who they are. And like I said, it's very helpful in some ways. But if that hypermobile patient has scapular dyskinesis, where their shoulder blade isn't actually working how it should, then I'm going to try and implement some changes on the scapula to try and actually improve some glenohumeral stability as they're loading overhead. So that's how you go down the injury prevention pathway, but you never actually know whether it works. Not in day-to-day anyway. There is some research about it. Let me find it actually, because I won't ever remember the percentages off the top of my head. Here it is. So there was a European handball study done in 2017 from Anderson Group, and they found that they implemented some shoulder injury prevention work, and they found that they had a 22% reduced risk of actually having serious pathology in the European handballers. So they found that their strength after the study was significantly improved, and they had a 28% risk of 28 can't English today, sorry, 28% lower risk of shoulder injuries and 22% lower risk of major injuries. So that was from an injury prevention study. That's all, like it takes years to get to that point. So it's going to take pole dance probably another 15, 20 years before we get some really good research out there about injury prevention. But until all of that comes out, we actually don't have any clinical evidence for it. So it's just, we don't have any medical evidence for it. We're going to just go based on clinical assessment and what we do face to face.
Yeah, that's awesome. It's a good point, and it's always something that I kind of like to reiterate is like nothing is going to 100% assure that you will not get injured.
Nothing.
That there's an inherent risk to the things that we do.
And we know that the biggest risk of an injury is a past history of an injury. Like I can screen you till the cows come home. I can find every little flaw in your body. And I always sort of joke with my patients that you come and see me and it's kind of a little bit sad to start with because I pick you apart and you go, why do I feel so broken? I'm like, no, it's not that. It's just we've got things to work on. But inherently the biggest risk, regardless of everything that I can find, is a past history of an injury. So if you've dislocated a shoulder before, you're going to, or not hopefully going to, but your biggest risk of injury again is a shoulder dislocation. Our job is to try and prevent that from obviously reoccurring as much as possible. So it's hard work. But that's why pole dancers and aerialists will always need to do their rehab. So once you've had an injury, you rehab it. You can't just stop it. And you've probably experienced that as an artist many times before, where you're like, I feel really good and I'm on top of this injury now, and you sort of let the rehab slide and then it comes back maybe 4 or 5 months later and you're like, I thought I bloody got rid of this. Like what the damn hell? Like why is this back? And it's about, once you've got an injury, it's all about trying to prevent that injury from reoccurring as much as possible.
You mentioned before you have a specialty in sports and conditioning or muscular, like
strength and conditioning.
What's the official title? Strength and conditioning.
Yeah.
Is that just something else that physios are used for, is kind of like the conditioning aspects? And have you incorporated any of that into your
No, physios are, I can't speak for everywhere else in the world, but physios are very poor when they start out at strength and conditioning. They have very little understanding. So it's a massive gap in our education in Australia and across the world. I'll just put that as a general rule. Physios are taught really good stuff like all the micro control and, let's do this activation and to try and improve baseline strength. But then they almost choke a little bit when it comes time to actually rehabbing the patient back to the sport. And I found that in my first couple of years out as a physio, I was like, I can rehab the everyday person that doesn't have to do much. But then this person wants to go back to playing football and I have no bloody idea how to get them there. So it was just driving me nuts. I was like, I should know this. Why didn't they prep us for this? And that's where my sort of interest went down that way. And I went and did further study in strength and conditioning. So the answer is a good physio will have some idea in terms of strength and conditioning. A great physio will actually have some, will be able to incorporate it into everyday practice. So whether you come in with an injury that needs to be treated with basic motor control principles to start, to then progress to a high level, there just needs to be principles of strength and conditioning throughout. And we're taught the principles, we're just not taught how to implement them. And I think that's probably the biggest missing link for a lot of physios across the world. Yeah.
That's such a good point, because as an aerial coach, I will have people sometimes who will come to me and they're like, I want to get back to where I was. I got injured. And my first question is always like, have you seen a physio? Have you been cleared by your physio to come and see me? Like, but then I'm always aware, because I do know that like you're most at risk to get injured if you've been injured before. If there is a different process to that aspect of rehabilitation, that is kind of getting them from like normal baseline to extra superhuman aerialist strength, right?
100%. So once you pass all the motor control principles, then you're just into your pure brute strength and power phase. So you're trying to go through basic strength principles to higher strength and then power, and it's going to depend on the sport. So again, as an aerialist, you're wanting to make sure that someone's super strong. They can load their whole body weight through their hands. So if that's what you need to, be able to get a patient back to, an aerialist back to, then you need to make sure that your principles are in your program. And I always talk about off the pole, and it'd be, off the silks or off the hoop or whatever it is that you're doing off, the apparatus. You need to make sure that it replicates the demands of the actual aerialist. So for a lot of physios, that's the gap that's missing. And I always urge physios that if they don't know what to do, then they need to get the patient to the next person. So for any physios out there that go, I feel comfortable with the motor control side of things, and I'm happy to build it up to baseline strengthening and maybe some external rotation stuff overhead, great. That's not enough to get an aerialist back there. If you clear an aerialist to go back to sport or back to training, and they've got full range of motion and they're okay with some external rotation, you are not doing enough. I'm going to put it out there for any physio that's listening here. You need to get them super strong at loading and stable in a pushing overhead motion, as well as a pulling overhead motion for pole dancers as well. So unless they're doing those things, they should not even be thinking about going back to high level training yet. So if that's not where your scope of practice lies, get them in to see a strength and conditioning coach or a coach or like an athletic coach of some sort that actually has that background and experience that can take them through the next stage, still off the training apparatus in terms of tricks, but building up the strength so they can build back to the apparatus. In this phase, though, it's really important to get them still doing some things on the apparatus. So quite often I'll say to the girls and guys that I treat, I'll go, okay, I'm not happy with you doing this particular trick, but I want you to work on your conditioning, and your conditioning will look like this on the pole, and here's your off the pole program. And we're working towards integrating more on the pole and less off the pole over time. So I think, there's no one answer in terms of, who should, take care of that person in that phase. I'm a bit of a control freak. I like to take care of people through that whole phase. So I went and did all that first study. I think people appreciate that. They appreciate seeing that one person through that whole phase. And so I'm happy to guide them all the way back through, but your physio may not. And so, if that's their scope of practice, they should just know their limitations and go, okay, this is, as far as I can take you, go see this person now. And so be it. And that's just that filling in stage. Yeah.
But it's such a good point that, because it can often seem very black and white, where it's like, are you cleared or are you not cleared? And if you're not cleared, then you don't touch the apparatus at all. And then if you are cleared, then you're like gung-ho game busters back to your like advanced level 16 class. And
it drives me nuts.
Yeah.
Yes, absolutely.
It's a very good point.
I'm a big fan of keeping people on the apparatus as much as possible. I can give an example of a patient who I saw online yesterday who subluxed her shoulder the day before. And I've already given her clearance to go back to doing conditioning on the pole. So I'm like, I don't want you to spend time off the pole if we can do this and this and this in a safe, pain-free and stable environment. So if that's able to, I want you do this. This is your strengthening off the pole. These are very clearly what you're not allowed to do on the pole. So I've made it very clear. My goal is to keep people on the pole, and that's why I'm like my little slogan, keeping you dancing. Like, it's there to help keep you dancing. It's there to help keep you, poling, keep you doing whatever it is that you want to do. I'm not here to go, okay, you need complete rest from your apparatus. There's occasionally a couple times where, there'll be things like fractures where, you just can't obviously pole with a fractured arm. You might be able to work on some one arm spins, but like, unless you're super high level, like, there's not going to be that much you can do. Generally speaking, most injuries can be worked around, and you're able to keep someone doing what they enjoy, so they don't feel like they're completely missing out of, 6 weeks off pole. That's so frustrating. And in the meantime, you're deconditioning your whole body and you're setting yourself up for further additional injuries. Just no. People as strong as they can, and then just rehab the injury at the same time. Like, if we didn't do that with football, with AFL, we would not have teams. It's probably the easiest way to explain it. Like, if the amount of injuries in a club of 30, 40, male and female footballers, if we sat every player out week to week based on the injuries that they had, we wouldn't be able to field a team. So, and it's the same with, NRL, and I don't know all the different leagues overseas, but all the sporting codes, all the things, Super Bowl, World Series, all the things that I clearly have no idea about. But like, if every athlete that was injured actually rested completely from their sport, they wouldn't be able to field a team. It just wouldn't be possible.
Wow.
So the amount of times we are pushing athletes through at a high level, and it's because they're athletes, that they're really super aware of their body, they're aware of their limitations, what they can and can't do. But we're modifying their load to be able to get them through. And we're completing their rehab. And these are not the acute injuries, again, where they've gone and torn a hamstring and they're back within a week. We're not saying that at all. But potentially someone who has maybe a proximal hamstring tendinopathy, so it's that ongoing chronic niggle, we're modifying their load week to week and doing their rehab so that we can settle it down. It takes longer to settle down, but you're able to do it and get them through the season. And I mean, they're earning big bucks to be there playing, so they're going to want to play as well. And just like, us, we're going to want to dance. We're not earning the big bucks, unfortunately, like I said, but we're going to want to dance. We're going to want to, hoop. We're going to want to silks. We're going to be able to do anything apparatus-y.
Yes. I have a little point of interest. I love what you're saying about all of this, and but the difference, I would say, between sports ball, World Series, Super Bowl, and aerialist dancers is they have a season. So there is a period of time. There is an aspect of like long-term periodization that's happening that we don't get in the pole or aerial communities. So how do you account for so that they can take that time where they're not expected to perform at or be in peak condition, where they can recover from some things and kind of nurse their wounds and then get back on the field the next season?
Yes.
How do you account for that in the pole world?
Yeah. So in the pole world, we still have a comp season, so to speak, but we still we train still outside of comp season. So that's the first thing, is that if someone is listening to this and they're wanting to be good for comp season, then post comp season, think of that as your off season time. You need to actually deload post that, and quite a considerable deload. So it would be 2 to 3 weeks of reducing load. So I'm very clear with rest, and I know a few other physios that are really big advocates for making sure you deload at certain points through the calendar. But there needs to be a 2 to 3 week deload at any point in the year, at least, as a bare minimum. But on top of that, every sort of around 8 to 12 weeks, depending on the level of the athlete, they should actually have a deload week as well. And I basically say it means no pole that week, nothing, no pole. And everything else is a go. So they can do, stretch class. They can do a conditioning class off the pole. They can do a dance class. They can do whatever they want, but just no aerial apparatus for that week. And people get really shocked at this. And I'm just like, it's okay. You'll survive a whole damn week. I promise. You'll be fine. You'd rather have a week of deload every 8 to 12 weeks as opposed to, 3 to 4 weeks of complete deload because you're injured. So you'd rather do it that way. So yes, you can work around the comp season, but for a lot of pole dancers in Australia and worldwide, they don't tend to do comps. So for them, it's about making sure that they're listening to their bodies and maybe following the term system. A lot of pole studios do like an 8-week term or a 12-week term. And so using that and going, okay, now this is my deload week. So for the first week of every term, I'm not going to book a silks class or a pole class or a hoop class. I'm going to keep it to very light load classes and just keep my week a bit easier. So it's just really simple. That's how they can do it. And generally speaking, most studios sort of shut down over Christmas for that sort of 2-week break as well. So you think of that as a deload period. The problem I see is people go, okay, but my work shut down. I now have time on my hands. I'm going to increase my load dramatically and just do all the pole things. And I'm like, that's not what the plan is. So if you're going to do that, then you have to find 2 weeks somewhere else in the year that you pretty much deload from pole. Yeah.
And when you come back from those 2 weeks or something, I've heard or I've found or talked to coaches, especially with high level acrobats, who say that that's the time when they get injured the most. If they've had a month off from break or something, they come back and then they're super capable, but they're, I guess, a little bit more deconditioned.
Yeah. And so like if it's 2 weeks, it's not as bad. If it's a month, you definitely have lost some conditioning at that point.
Okay.
There's a lot of contention in evidence about increasing load and load monitoring. And, there used to be like an acute chronic ratio we used to talk about. And we used to say that, so I'm not sure if you've heard of it, but if you increase your load 1 week, then 2 weeks later is when you're going to feel the effects. So it's not usually the first week that you return back to load. It's usually the 3rd week or 4th week that you get injured. So there's some thoughts about that out there in the sports medicine community. Basically, there's, again, no scientific evidence or minimal behind this to actually say this is how you should do things. But we, from clinical experience, can say start low. Just bring yourself back a level. So if you were an elite level, person before you went on break, start at high advanced and build yourself gradually over the space of a month back up to elite. And so that's if you're having at least 4 weeks off. If you're having 2 weeks off, you can return back to elite, but you're going to start things a little bit lighter in elite. That's basic principles. But yeah, there's a little bit of contention out there in the sports medicine community at the moment as to this acute chronic workload ratio. If anyone that's listening and knows what I'm talking about, it basically says that, your load over 1 week compared to 4 weeks is your chronic load. And we can measure how quickly you increase your load. So we used to say if there was an increase more than 150%, you're increasing your risk of injury dramatically. So it gets technical. I won't bore you with all the details, but it's definitely something for any nerds out there like me to.
I can't wait to Google it later. Yeah.
Tim Gabbett is the leading mind behind that. So his team in Queensland is basically pushing that all out there. But there's been some people out there who've been arguing against it. So it's a little bit of a hot topic in the sports medicine community the last sort of probably 2 years anyway. Yeah.
Okay. Interesting. How does being a physio influence you as a pole artist?
Too much. I am so particular now about when I go to pole. I just probably spend way more time off the pole than on the pole now, doing rehab. I have my own injuries like any other person. I'm not immune. I'm not superhuman because I'm physio. I would spend so much time going, yeah, this is a good shoulder day today. I'm happy to do this and this on the pole, or God, no, this feels absolutely rubbish. I thought mentally it was going to be epic and I just feel like a potato sack. So I'm just going to not do this today. So I listen to my body a lot. I then go with the flow a lot more as well. Whereas I find that a lot of non-physio polers, most people in the world out there aren't physios, surprise, that they are more likely to push through a bad day. So they're just not listening to their body. And it's so funny because so many things need to work together to create a good day. Like you need to have, good diet, good sleep, low stress levels. You want to be thinking about your hormones, what's actually happening in your cycle. So there's just a bigger, I guess, range of things that need to just sort of click together to make it a really good workout day. And you can definitely push through days where you're not feeling as great, but I'm just less likely to push through those days now. I definitely train less to have more rewards. That's probably the biggest thing that I do as a physio. Yeah.
Yeah, this seems to be something secretly that you all are very capable of. I noticed this with Jen as well, that it seems like like you have some kind of secret understanding of what's going on and can make gains without being in the gym as much as the rest of us. So
Well, I think Jen,
it's magical.
Jen just, I think she explained it brilliantly a couple of months ago, whenever it was, that you can plan out your weeks as best as possible. Like, you can have the best exercise science behind it to go, okay, this is how we're going to progress over an 8-week period. But if you wake up feeling shit, you feel shit. Like, listen to your body. Just, you know, if you, and she put it a lot more succinctly and quite nice in a couple of posts, but if you feel crap, just listen to yourself. You're not going to do a high-load train that day. You might do some training, but it's going to be low-load and it may be off the apparatus. So I think you just have to listen. And yeah, we do have sort of a secret understanding, though. We're magical creatures, physios. I think we're just good at going, okay, this gym work relates really nicely to this pole work. And I think we just have that biomechanical understanding, and that's something that can be taught over many, many years. But God, it's a hard thing to learn and to grasp. Yeah.
Brilliant. Simone, where can people find you if they're not already following you on all the social media places?
Yeah, just at thepole.physio on Instagram and pole.physio on Facebook. I have a YouTube channel as well, but I'm not as active on that, but you can certainly follow me there. On my Instagram, I've got a tap link in my bio, so you can click on that. You can subscribe to emails. So I will have early blog releases and lots of fun freebies coming up for subscribers. I'm getting onto it. I promise it's coming soon. And then I've got so much free information out there for pole dancers and aerialists on my Instagram page in the link. So I've got all these amazing anatomy blogs for anyone out there who wants to sort of conquer their nemesis tricks. I've got straddles, I've got Aisha, handspring. I've got my next one coming out soon, so I won't spoil that one. I've got some front split series, as well as just really good optimal periodization and rest management and recovery management. So all the principles of strength and conditioning are there, and a couple of cute little blogs that help to maximize your training as well. So there's a lot of brilliant resources on my my website, and it's just all accessible via my Instagram page. So yeah, make sure you check it all out, because there's just so much good stuff there.
Yes, awesome. Well, thank you so much for being one of the growing people in the industry, in the healthcare industry, who see us, the weird outliers, and need some help, but are scared to go to a normal physio because we don't like being told no. So thank you for figuring out how and saying yes.
Thank you so much for having me. And yes, for anyone who's like a physio that's an aspiring, potential pole physio out there, feel free to get in contact with me, because we do need more of you out there in the community to try and help as many circus and pole dancers as possible, artists. So yeah, please get in contact, because we need more out there. And I know Emily Sherb, so the circus doc, is doing some great work in terms of mentoring future physios. And yeah, I'm very happy to also extend a sort of an olive leaf to anyone out there who may be interested, because we need more of you.
Yay, yes. Okay, final question, Simone. What advice would you give to yourself at the beginning of your career?
That's a really hard one. I love that question. I don't know if I follow my advice, though. I'd give myself advice. So my advice would be, don't work too hard, but I definitely work too hard at the moment. 100%, it would be, you don't need to prove anything to anyone but yourself, and just stick to what you know. I know that sounds terrible. It's not terrible, it just sounds crap. It's very cliche. Why am I so cliche?
So the best advice always is, though. God. That's the problem.
Just stick to what you love, because what you love is what you go. And this is for anyone out there. Yeah, stick to what you love, because that's where you're going to be most passionate about, and that's where you're going to really want to make a difference. And if you are passionate about something, you just don't feel like you're working. And I know I work way too much, but I don't usually feel like I'm working, because I love it so much. Like, I just really enjoy what I do, and I love making a difference. So I think, that would probably be the advice from 10 years ago, and get out of AFL sooner and find the pole community. That's probably the other bit of advice I'd say is just find the aerial community sooner, and you'll love life. You'll get to be a fun little unicorn. So yeah. Love it.
Amazing. Well, thank you so much again for coming on, Simone. I so appreciate it.
Thank you so much.
that was my interview with Dr. Simone Muscat, aka the Pole Physio. And oh man, you guys, what a conversation it was. So many good reminders about times to take, a recovery week, or to not ignore a pain that you have or you may feel, something lingering, not to fight through it, but to actually actively seek out medical professionals who can help you. Now, I'm super lucky. I live in Montreal and we have incredible physios here. We have amazing osteopaths. We have people who know circus bodies. They know what we do. They know how we get injured. And I'm very lucky to have people like Simone around me who are closely affiliated with Circus. However, a lot of you guys might not. And if you don't, Simone has some really great advice. She started by saying, bring in a video of what you are doing. Bring in the trick. Show your physio what you are doing, where it hurts, and then a video of someone doing the trick that you want to do well, so that they can see what's required and maybe what you're missing. And as I said, try to find a physio who asks a lot of questions. My favorite physios are the people who get very curious about what I'm doing, what my activity is, and how that led to my particular pain of the day. And through that kind of collaboration, we are able to find a path of treatment. I want to really empower, kind of like I said on the last episode with Delbert Hall when we talked about rigging as a collaboration between riggers and aerialists. Aerialists have to be so many things. We have to be athletes, we have to be artists, but we also have to be aware of what we're hanging from. So we kind of have to be engineers. And while obviously we are not physical therapists, we have not gone to that many years of schooling, some of us, we do have to know and be proactive about our bodies and be able to advocate for ourselves, what feels good, what feels right. And when you run into a healthcare provider, professional, who is either not really interested in what you have to say or shuts you down with oh, you'll never do that again, or stay away from that, you can know that that is not the end of the world, that is not normal, and that there are people out there, there are incredibly well-educated doctors who believe that they want you to get back in the air, dancing and performing and learning as fast as possible. And so thank you to all the physios out there who do that. If you want to follow this particular physio, the Pole Physio, she's at thepole.physio on Instagram. www.simonemuscat.physio is her website, and she has an incredible blog on there. It's all entirely free resources, friends, fans, and foes. And this is the kind of information that is not readily available because it can only really be delivered by healthcare professionals. So go check out her blog, go check out her Instagram, and keep learning. For aerial training tips and inspiration, you can follow me on Instagram. I'm at _artist_athlete. My website is theartistathlete.com. I should get theartistathlete.aerialist. How badass would that be? But for now, it's theartistathlete.com. I'm on Facebook, The Artist Athlete. I'm on TikTok, The Artist Athlete. And of course, my Patreon, my pride and joy, patreon.com/theartistathlete. Thanks for tuning in, friends, fans, and foes. I'll talk at you next week. The Artist Athlete podcast is supported solely by donations from people like you. Here's what some of those people have to say.
Hi, my name is Noah and I do hand balancing. Hi, my name is Woody and I do Leo walk. Thank you for listening to the Artist Athlete podcast.
Hi, I'm Freya. You can hear my whole story in episode 50 of the Artist Athlete podcast, but I'm here to tell you about something else that I do. I'm a qualified health and nutrition coach. I help people with sleep and body confidence, among other things. You can see everything I have to offer at wildguidance.com or follow me on Instagram at wildguidance.
Hi everyone, I'm Dominique, a ground acrobat, trapeze artist, and coach, currently bringing circus to the extremely cold but very beautiful Northern Ontario, Canada. Circus has changed my life and I'm so grateful to everyone in this community. Find me on Instagram at DomUpsideDown or my website domupsidedown.com.
Aloha! My name is Beth Russell and I live on the beautiful island of Maui, Hawaii. I am an aerial artist and movement instructor specializing in chakra yoga to keep me balanced and grounded. I play with silks, trapeze, lyra, rope, acro, aerial yoga and dance, slacklining, pole, bungee, and climbing. Really anything that goes up and allows me to explore 3D space. You can find my dedicated aerial page on Instagram at Maui Aerialist. If you find yourself coming to Maui, let's play.
Hey there, friends, fans, and enemies. This is Chris Alston, Patreon of the Artist Athlete Podcast, straps artist and lyra performer and acrobat out of Greenville, South Carolina. So if you're ever passing through, make sure to stop in and see me and my friends. We have a wonderful space and we'd love to see you.
Hi, my name is Erica Lee. I'm from St. Louis, Missouri, and I'm an aerialist. I teach performing arts to elementary school during the day and do pole and sling and rope by night. I really, really like the Artist Athlete podcast because it gives me a lot of circus goals to look forward to. It gives me a lot of insight on what's going on around the world in circus, and that's why I'm Patreon.
Hello all. Thank you for tuning in to the Artist Athlete podcast. I am Opal Schwartz from Minneapolis, Minnesota. If you're ever in the cities, feel free to stop by the Aviary Minneapolis. It's a great time. With that, I hope you all have a wonderful rest of your week, and goodbye.
Hey there, artists and athletes. This is Andy Smith, owner and artistic director at Saltaire Circus School in Jacksonville Beach, Florida. And I want to thank you for contributing to the Artist Athlete podcast. If you ever find yourself down in Florida, come check us out. Whether you're an artist, athlete, or someone ordinary just looking to be extraordinary, we got a place for you.